Hi folks, Paulie, RFCradio.com, here today to talk about single-payer healthcare insurance. So what exactly is a single-payer system? A single-payer system is one in which a single entity, the government, collects almost all the revenue for and pays almost all the bills for the healthcare system. Today, we have a free market system where people and employers have choice. Employers, who provide insurance coverage for most Americans, search the market for the best plan for their employees and change plans when needed. I know personally, my plan has changed 3 times in 5 years, and this is a good thing. Companies grow, change in sizes, they want to change the benefits and get the best price, bang for the buck for their employees. But why do Democrats want a single-payer system? After all, President Obama, Barney Frank, and many other politicians have openly stated that they desire to have a single-payer system. They want to eliminate evil insurance companies from the picture. Those same insurance companies that employ thousands upon thousands of people around the country, those same insurance companies that earn a whopping 4% profit margin on the services that they provide Americans. But as our government keeps on telling us, profit is bad. So why do they want this system? Power and votes. If Democrats provide coverage to the poor, they will get more votes and stay in power. It's that simple. They don't care about who pays for their proposed legislation, us. They don't care if millions lose their coverage or their jobs due to legislation, which is actually the case. They just want the control. Now, what makes me crazy, among many things, is that the Dems have complete control of our government already. This plan is a pig. They could pass it in a heartbeat, but they won't, because they know that once America learns that it's a pig, they will have complete ownership of that plan, and they'll be voted out of office. They'll learn that everything conservatives have been saying about the plan, job losses, longer waits, increased costs, will come true. So that's why it's so important that they have bipartisan voting of the plan. Now, I can't understand why the same people who think that we stink at handling Katrina, the same people that think that we flew jets into our own towers, want the same government that has turned Amtrak, the post office, and Medicare and Medicaid into financial embarrassments, want to take over the health coverage. If you think the conservatives just want the status quo, a popular Democrat catchphrase these days, you are very, very wrong. Conservatives want change, but we want change that works. After all, when in history has more government been the right answer? So you're thinking, okay, Paul, well, you're so smart. What's the answer to the problem? Number 1, allow Americans to shop for health insurance across state lines. This would give us instant competition. Competition lowers cost, it increases choice. Bad companies fail, good companies grow. It's just plain economics 101. Number 2, tort reform. Cap medical lawsuits for most, if not all, cases. Allow doctors to practice the art of healing instead of defensive medicine. Did you know that some doctors are paying $30,000 or $35,000 a month just for malpractice insurance? 3, motivate insurance companies to provide coverage to people of all incomes, including the poor, by giving insurance companies tax breaks for meeting certain thresholds of low-income enrollees. And 4, term limits. If politicians have a limited time in office, they will focus more on getting stuff done instead of keeping their jobs and their posh benefits. Take the power away, and life gets better for Americans. We don't want the status quo, and we don't want the government turning our healthcare system into Amtrak. Thanks for watching.